Hey, Virginia Beach residents, it's Brandon Mitchell coming to you with another VB411 in the know. In all news related to COVID-19, you may have heard reference to something called contact tracing, which is a way to help combat the spread of the virus. Well, earlier I spoke with Anna Barringer from the Virginia Department of Health to give us some insight on exactly what contact tracing is and how it works.
Yes, in public health, contact tracing is the process of identifying those that may have been exposed to someone who is diagnosed with a communicable disease. In this case, we're talking about COVID-19. The purpose is to quickly identify these close contacts and implement control measures to help prevent spread in the community. To add to that, close contacts are identified as those persons that have had less than 6 feet in proximity exposure for a minimum of 10 minutes. So that's how we identify close contacts.
So the health department has staff who serve as contact tracers, and they call individuals who may have come in contact with someone who has tested positive for COVID-19.
When a contact tracer makes a phone call to a close contact, basically they inform them that they are with the health department and the reason for the call. They want to ask if they are aware of a possible exposure to COVID-19, and they want to assess to determine if the individual is experiencing any symptoms. Are they aware that they have had an exposure? Have they recently been tested? And they would inform the individual that they should stay home on quarantine for a 14-day period from the date of the last exposure to make sure that they don't develop symptoms and spread it throughout the community.
Since the month of March, the Department of Health has made more than 600 plus contacts to persons who may have been exposed to COVID-19, and then also provides them instructions on what to do next.
We actually implemented contact tracing with our very first COVID-19 case in Virginia Beach back in early or mid-March, and we have continued the process with each case that we have interviewed since then.
I also asked Anna, how do you maintain privacy for individuals when you're trying to connect those dots with contact tracing and COVID-19?
We fall under HIPAA, so it's very important for us to protect the privacy of the individual. In most instances, when we make that phone call, we do not identify who the case patient is. We just provide the necessary information to make sure that the contact can comply and is aware of.
Is there anything residents can do to assist with the health department's contact tracing efforts?
Yes. First of all, in Virginia, we are under a stay-at-home order by the governor, and we request that all residents comply with the stay-at-home order. For those that feel like they are developing symptoms, if they've had an exposure or they are seeking testing, in those cases, we would ask that they start thinking about the places that they've been, the people that they've been around, and who they may have exposed, because when they become a case of COVID-19, the first step is to interview the case patient, and we're going to ask those questions.
For more information on contact tracing and the Department of Health, please visit their website, which is vdh.virginia.gov/coronavirus. Do also remember to visit our emergency website, which is emergency.bbgov.com/coronavirus, for all the up-to-date information on COVID-19 and resources for not only residents and business owners. Until next week, Virginia Beach residents, thanks for watching. Please continue to stay safe.